So, hey, Peter, nice to meet you. I'm Srinivas Velamoor. I'm the president and CEO of NextGen Healthcare, and we are a integrated solutions provider for ambulatory medical groups and practices. Been around for over 40-plus years, and we provide EHR, practice management, and financial management solutions for 40 different clinical specialties in healthcare today.
Oh, interesting. So tell me a little bit more about is it a platform? Is it a whole solution? Like, what's the offering?
It's a platform. So the electronic health record system and the practice management system, usually our clients buy both of those together. And it allows the physicians to conduct their workflows all the way from seeing patients to documenting the encounters to setting up ready to submit claims and manage the financial aspects of their practice.
Yeah. I'm going to guess that the options available to your clinicians or the alternatives for documenting their healthcare encounters are pretty vast, everywhere from manila folders and bits of paper right up through to various technology solutions. Like, what are there particular use cases or clinical specialties that are really kind of leaning into the platform?
Yeah, EHRs have been around a long time, and the government essentially mandated that all providers use one of these ages ago, so at least I hope the manila folders and the paper versions are no longer around. But as far as why people pick certain EHRs across specialties, it has a lot to do with price, it has to do with the quality of the clinical content, it has to do with whether or not the platform reflects the reality of how the physicians practice and see workflows for that particular clinical area.
Those optimizing those workflows is usually a critical area of focus, and really trying to get a good understanding of how a clinician's kind of engaging with a patient on day to day is pretty crucial. How do you go about ensuring you've kind of nailed those workflows, or really optimizing the time that the clinician's got with the patient, so they're spending more time with the patient, less time with their head on a computer?
Yeah, absolutely. You know, one of the things that was differentiating about NextGen is it's one of the first EHRs that allowed 100% customization of these workflows to providers. So at least in the early innings of our platform, the ability to make it your own was really what attracted folks the most. As we've gotten smarter about clinical protocols and guidelines these days, there's a little more standardization. So people don't want it to be 100% customized, but there's a lot of emphasis on taking friction out of that whole process. So can I complete my encounter and my documentation with as few clicks as possible? And then you bring in artificial intelligence now. The next paradigm is, can I just talk to the system instead of even typing anything at all? And can it do a lot of the heavy lifting behind the scenes for me? So that's really where we're innovating next.
Yeah. Well, I'm keen to learn a little bit more about that for the next gen. How are you thinking about how artificial intelligence is going to be incorporated into the platform?
So we have a solution we call Ambient Assist. So for folks that one of the first things we did was untether the physician from the desktop. So now they can use a tablet and a mobile device and walk around and see patients, and it records the encounter on the mobile device while we're having a conversation like you and I are. And it's able to then save that transcript and turn that into actual clinical documentation, into codes, into order sets. Physician can review it on their mobile phone, verify that it's correct, press a button, and it writes everything into the desktop version of the product very seamlessly. So early results are very encouraging. We're seeing physicians save anywhere from 45 minutes to an hour and a half of their day by deploying this approach. That's just the tip of the iceberg.
How are you thinking about, from my experience, say like an EHR or practice management system, they've got an option of trying to build a lot of different features and capabilities that might suit particular clinical requirements or operational workflows. Other times it's trying to open it up as much as possible and lean into that provider network or the vendor network to be able to partner with different technology capabilities to offer up a kind of more integrated solution, but utilizing different specialties. How do you go about thinking about building out some of these tools? Like, focus it, like, do you just build the platform for others to kind of build on top of, or do you really kind of niche into a particular area?
I love that question, Peter, for a whole host of reasons, because I think the EHRs, particularly the platforms that we have on the hospital side, have been maligned for a long time for being gatekeepers, not gateways. And there's I think it's important for organizations like ours to resist the urge to say, we're going to build everything, it'll all be proprietary, and we're not going to permit best-of-breed solutions to be made available to our clients. So there are a bunch of things going on in that regard. with the new information blocking guidelines out there, there are interfaces that are available for any third-party solution to integrate with our platform. And if our customers find value in it, they can connect via APIs and use these third-party solutions. There are some areas where that level of integration between the solution and our system has to be so great. In those instances, we partner a lot more actively with those third parties to make sure that it's plugged in seamlessly and it doesn't break something else in the system. And those are areas where we're going to take more of a proprietary stance to make sure the experience is good. But for the most part, our desire is if someone's really solved the problem, the ROI is clear, we don't feel compelled that we have to build it and own it ourselves. We're happy to work with others to do that.
That's interesting. And so where is all the activity going to be focused on over the next kind of 6, 12, 24 as you're building stuff out? I've talked a little bit about artificial intelligence, but what are you looking forward to kind of sharing with the broader ecosystem over the coming months and years?
I think the biggest thing for us is to recognize that the patient-provider encounter is really evolving at an incredibly rapid pace. What physicians expect when they walk into an exam room or get on a screen for a virtual visit, and the way in which consumers want to engage with the health system, they've changed by leaps and bounds just in the last 2 decades alone. And as we're designing these solutions, we're thinking about what do these workflows look like tomorrow versus trying to optimize the solutions of the past. Everything from using voice as a primary input device, doing intuitive navigation so people don't need to actually sit at a desktop to change things, embedding artificial intelligence and automation to take away manual tasks that are repetitive that nobody wants to do. Taking the vast amount of data that's available to us now, summarizing it using AI and giving you insight so you can make better decisions as a patient and as a provider. These are all areas where we're investing very actively. And then most of the practices today, because of inflation and utilization going up, are under tremendous financial pressure. So really focusing on how AI and automation can help them do more with less. Where can they self-serve? Where can patients self-serve? Can you do your job with 2 fewer administrative staff sitting at your front office? Can you predict the errors that you're likely to get in your claims before you submit to an insurance company so you can get more money coming in through the door? They can post those cash payments more efficiently. These are all areas, nuts and bolts stuff, doesn't sound very exciting, but it's the difference between a practice staying alive 2 years from now versus being under tremendous pressures.
It's exciting to the right people, it's fine. But then and as we're kind of wrapping up health here in Las Vegas 2024, are there any kind of key takeaways that you've got, or I believe you're doing a session or sharing some information with attendees? What are you hoping others might take away from this event as well?
Yeah, we are about to host a panel that's talking about reimagining that patient-provider experience. AI is just the tip of the iceberg. We have things like digital twins and anatomical virtualization and a whole bunch of other exciting things, advancements on the clinical research side that are available to patients now and to providers. And so we'll unpack a little bit of how should all parties involved think about this, what will it take to make sure it actually sticks? Because cool ideas, sometimes they stay on the shelf. And we want to make sure these actually get used to create results. So we'll be talking about that. I think for our broader health participants here, the amount of innovation that's out here on the floor is tremendous. I think our takeaway has been there's a lot more value in ensuring that we see some of these innovations all the way through to impact and potentially figuring out how to adopt and integrate things that have been around for 5-6 years versus just jumping to the next shiny new object here. I think we would all benefit from a little more of looking a little backwards and forwards at the same time.
I like